Professor Agnes Benengao. She is a co-chair of CPHIA-2021 and 2022. So our distinguished panelists are here to just give us an overview of what we should expect this conference to be. And so we're going to start from my immediate right. As the co-chair of the conference, she's going to lay out the groundwork for us, and she will be followed closely by Dr. Ahmed, and then the Honorable Minister will come in. So, distinguished panelists, you have got 2 minutes just to set the stage for our conversation, and we can proceed. Over to you, Professor.
Thank you, and welcome to all of you. It's a pleasure to be here at this media briefing for the mega conference which is going to start tomorrow. This conference is very important. It's the first in Africa that brings together all the countries in Africa for exchange in what is going on in the public health arena. You know, we used to go all together to Europe, to America, to explain what we are doing, isn't it? We are doing great things. Why not to do something here? And we are very pleased to be hosted by the government of Rwanda, represented here by Honorable Minister, and also CDC Africa. It's a great moment. Why? Because it's time for Africans to be proud of what Africans are doing. It's time for Africans to do more and understand that they can do more for themselves, for the health of their population, and to organize the public health sector. So let's talk about that because it's an important subject, and we are very pleased to lead the way.
No, thank you very much, Professor Benengao, and good morning, good afternoon, good evening, wherever we are joining from. 3 pieces of information that I would like to share. One is riding on what Agnes has already said. We have so far about 4,200 delegates registered fully. Others are still registering. So this is the first in-person edition of the Conference for Public Health in Africa, and we are very pleased with the turnout so far. The main conference begins tomorrow. Today we have pre-meetings, side events, and they're all flowing extremely well. And we are also looking forward to the side events to continue during the whole week of these meetings. So the conference main starts tomorrow, but the side events have started today and started very, very well. Second thing that I would like to say is we are looking forward to the official opening tomorrow, and the Honorable Minister will speak about that. But as we officially open it, we also need to officially appreciate the weight that Africa has decided to carry. It is the weight of knowledge. And the amount of knowledge that is being shared today, tomorrow, until the end of the conference is enormous. And as Africa CDC, we have committed that the recommendations that will come out of this conference are going to see a path into policy, are going to see a path into implementation at country level. Because we've talked enough, it is time for action. So this is a conference of action, and we are looking forward to those recommendations. Finally is the sheer support that we have seen from all our governments across the continent. All the 55 countries are actually represented here in this conference today, all 55 member states of the Africa Union. And we are very proud and we are grateful for the leadership that our governments, our heads of states, our ministers have shown during the time of arranging for this conference. And we are really committing that we are going to take whatever it is that we've discussed to them so they can be able to see that the idea that they had, the child that they delivered for us is growing and growing very well in the shape of Africa CDC, in the shape of this conference, in the shape of public health discussions here on the continent. So we are looking forward to a very, very robust and a productive conference that is going to be the beginning of even better conferences that are going to come after this. Thank you.
Thank you. Welcome to everyone. I'd like to start by welcoming you to Rwanda. It's a pleasure hosting you to our beautiful country. And Rwanda is delighted to really hold this first ever in presence Continental Public Health in Africa conference. And I think it's going to be, as my predecessors have talked about, a unique platform really to share what we've been doing in the last couple of years. There's a lot that Africa has to share with the world. And it's going to be a unique platform where you have a variety of researchers, policymakers, scientists, you name it. So I think we're going to take opportunity of this conference to discuss what we have achieved, but more importantly, charter the course of what we're going to achieve next. There's going to be a lot of discussions and way forward to build more resilient health systems in Africa. We've seen what we can do. We've seen areas where we can improve, and we're going to share a lot of knowledge, expertise, experience to better our continent's public health scene. So mine is just to welcome you and to tell you that we are really excited to have you, and that along the 9 tracks of the conference, there are many, many interesting discussion presentations that are going to happen. And we welcome you to share what we'll be discussing here, because there's going to be a lot of important things that will come out of this. And we wish you a pleasant stay here, and all of you have a wonderful conference, and we are all here whenever you need us. Thank you.
Thank you, Honorable Minister, and to our panelists. So we're welcome, starting off from the very last speaker. We're all welcome to Kigali, Rwanda. And of course, let's look out. We can look out for action and implementation as Africa CDC is focused. And then you heard Prof. Beningao say, it's time that we show the world what Africa can do. Colleagues, it's now time we move into our question and answer section. As usual, those online, you can make use of our platform. Of course, the Zoom platform, you can use the Q&A section. We can use that. We can put your question through to the panelists. You can also make use of our WhatsApp number as usual, +251 94550 2310. To our colleagues in the room, just raise your hand for any of the panelists that you have a question. We can afford you the opportunity to ask your question, and the panelists can address the question accordingly. So we're going to start off within the room. Question from within the room. Remember, you have to introduce yourself and then tell us the institution you work for. That would be very helpful. Questions in the room? Yes.
Thank you so much. My name is Sarah Jervey, and I'm a journalist with DevX. Dr. Ahmed, you've mentioned previously that Africa CDC now has kind of a broader mandate looking at kind of disease and prevention beyond public health emergencies. I'm kind of wondering if you can elaborate on that and what you see moving forward for Africa CDC.
Thank you, Sarah. Indeed, the mandate of Africa CDC is disease control and prevention. So we prevent, and then if it comes, we control it. The most urgent needs right now are largely around health emergencies and disease threats. But the whole remit of disease control and prevention is our mandate. The way we see things going forward is when we harness the capabilities on the African continent, and that's its experts, its institutions, its public, its private sector. When we harness that and we gear it towards controlling outbreaks and disease threats, then we can settle down on doing the more routine work of strengthening our health systems, training our experts and keeping them here on the continent. This is what we aim to go and do after we put good control of health outbreaks. How are we going to do that? strengthening our institutions at the country level. Our national public health institutions, our national CDCs, they need to be capacitated to be able to respond quickly whenever there is an outbreak within the country, and they need to be capacitated to have the right tools, including laboratories, etc., to do that work. When they are functioning properly, as Africa CDC, we'll be doing mostly coordination, and then going into the longer term health system strengthening area of work. So our mandate is broad. We are dealing with the emergencies, but long term, we are going to deal with healthcare in a more holistic way. Thank you.
Thank you, Sarah. We see a second hand. So let me have a balance. Let me go on the other side of the room, then I'll come to you.
Thank you. My name is Gadi Chibahiro. I'm a local journalist here in Rwanda working for Flash TV and Radio. I wanted to ask this question in Kinyarwanda for those who speak in Kinyarwanda on the panel. Of course, I have to ask the minister. Nyakubahwa Minister, turimo turibaza ku bijyanye n'inama. Ni inama ije kwiga kuki, ni inama abanyarwanda batezeho iki, izabasigira iki, by'umwihariko inyungu iri mu kuba u Rwanda rwakwakira iyi nama ni iyihe? Murakoze.
Urakoze Gad. Iyi ni inama mpuzamahanga yita ku buzima rusange muri Afurika. Akaba ari bwo bwa mbere iyi nama ibaye abantu bahura. Bwa mbere yabaye umwaka ushize, iba mu gihe turi muri COVID. Abantu bayikorera batabonana, ariko nibwo bwa mbere. Icyambere naheraho nuko ari by'agaciro ku Rwanda ari cyo gihugu cyahiswemo kwakira inama. Bikaba bifite byinshi bivuze, nuko biba bigaragara ko rufite icyizere mu buryo ubuzima rusange mu Rwanda rumeze. Ikindi nuko ruzitabirwa n'ibihugu byose bya Afurika. Afurika ikaba yaragenze urugendo rurerure mu ndwara no mu buzima rusange. Twaba twarabashije kugera ibyo tugeraho byinshi, ariko n'inzira ikaba ikiri ndende. Muri no nama rero ni ihuriro ryiza ryo kuganira ku buryo inzego z'ubuzima muri Afurika muri rusange no mu Rwanda naho rurimo twazikomeza. Kuzikomeza mu buryo twajya tubasha guhura n'ibiza cyangwa n'izindi ndwara zimwe zikomeye n'ibyorezo, tukahura nabyo kandi tukabasha kubikemura neza. Mu gukemura ibyo byorezo biganatanga n'ikindi cy'uko inzego z'ubuzima zigakomera ku buryo ikintu icyo ari cyo cyose cyaza kitaguhungabanya, kuko urabizi ko iyo ubuzima buhungabanye, ubukungu burahungabana, umutekano urahungabana. Rero bikaba ari ihuriro ryiza tuzaganiriramo ukuntu twakomeza izi nzego z'ubuzima ku rwego rwa Afurika muri rusange. Urumva rero uburemere bw'iyi nama, tukaba twishimiye kuyakira, kandi tukaba twizeye yuko ibizaganirirwamo n'ibizavamo bizafasha igihugu, ariko bikazanafasha n'umugabane wacu muri rusange. Murakoze.
Thank you, Honorable Minister. We'll just go for the next question here.
Yes, thank you. My name is Riakus Buguzi from Tanzania. I write for SciDev.net. This is a follow-up on an important issue raised by the professor there about Africa discussing public health problems on African soil. And I would like to ask her to explain a little bit more on how this can help Africa build stronger public health institutions. Is this approach, do you find it, how do you find it as a better approach, in terms of helping Africa build its own institutions? Thank you.
So, coming together as experts from all African countries and friends from out of Africa, but also as institutions from Africa and ministries of health, because we have ministries here, and discuss about public health in Africa can only make us understand better what are the matters that matter on our continent. Normally, what happens? We all go to London, Paris, New York, or sometime Boston, whatever, and be part of a discussion that is global, but where Africa is not the priority. Here, we are all together discussing about the situation in Africa and how all of us together with African leaders, African institutions, African experts, we can do better. We have done good with COVID. Were we lucky or were we prepared? If something else happened now, are we prepared? We have got quite good coordination. Was it by chance or by preparations? There is a lot of questions for what is good, what is less good, and what is bad, so that we can improve the health of our population. I answer your question?
Thank you. I think the director wants to add to that.
Yeah. You know, the African discussion is the core of this conference, and I fully agree with Agnes. I wanted to add one thing, that we must build our confidence as a continent. We must build our confidence as professionals in Africa, that we can be able to organize this, come together, talk about our challenges, propose solutions, and then when we go back home, we go and implement them. You strengthen the professional, you strengthen the professionals' institution, you strengthen our member states and the governments to be able to do more based on the priorities that we've discussed and the solutions that we have come up with. This is the solution for professionals in Africa going forward. The opportunities of going to speak elsewhere will always be there, and I fully agree with Agnes that we can share, but this is where you start, because charity actually begins at home.
Okay, another question right here.
Good afternoon, panelists. I'm Monica Mayoni Kayombo from Zambia Daily Mail. I understand that this conference is meant to prepare African countries to respond to future public health threats. And what I know is that definitely we have qualified doctors, public health experts and all. But my question is, what systems have you put in place to ensure that we move at the same pace as a continent? Because different African countries have different challenges, and that means that they wouldn't, if there's no proper system put in place, they wouldn't move at the same pace with the other countries. Do you have maybe a contingent plan? Do you have the budget to help countries that may be facing challenges in meeting your objectives? Thank you.
Quite a loaded question there. So I think my boss is armed with some answers for that, and we would like the minister or Prof to add on to what Dr. Ahmed says.
Yeah, no, thank you, thank you. I didn't know Zambians ask hard questions. But do we have a system in place to take us forward? Yes. In fact, we have a vision, Africa's new public health order. When we implement that, we are going to do much better than we are doing currently. Do we have a system, in other words, a vehicle to be able to ensure that our countries are making progress? Yes. One thing we must appreciate is we are not aiming for all countries to be at the same place immediately. Everyone is going to move at the pace at which we can be able to support the countries to move. We don't want to, even within a country, you'll always find there are differences from one region to the other. The same thing for the continent. But we have three very important mechanisms that we're going to use. One is a platform of the ministerial level platforms that we have, where policies are going to be developed in a way that are implementable on the continent. Second is our national public health institutes and national CDCs. They are the technical arms of our work, and we are providing them with all the support that they require so that they're able to implement what we are agreeing on. Third are our partners. Partners are providing a lot of support on the continent, but we want that support to come in an organized way and follow the path of what has already been agreed by our national level institutions and our ministers. So these three different paths are the ones that we are going to use to ensure that whatever it is that we are agreeing on are actually going to be implemented. And in any case, we are meeting every year. At the next conference, we are going to check where are we, what can we be able to do better. And we'll be doing this progressively, each and every conference, each and every meeting that we have an opportunity to be able to discuss our progress, we will do that. The important thing to take away from this is the journey has started, and we are going to progressively build Africa's local capacity to be able to implement all that we are agreeing on based on the vision, Africa's new public health order.
And what is important to add on this is that there were already exchange among Africans, but not in a coordinated manner, and not at the path our population needs. And COVID was a great booster for that. The more we share the discovery from the west to the center, from the north to the south, the more our population will be ready and care of. So this is one of the major outcomes of this conference, and one of the major role of CDC Africa, one of the major role of all those ministers coming together to discuss how to coordinate and how to collaborate.
The minister wants to ask something. Yes, sir.
Yes, right. So I think one important thing in Africa is that, let me take an example of a family. You have different children that are endowed with different strengths, and the most important is for family to coordinate in a way where all those strengths are used for the benefit of the family. So this is how we plan to do things in Africa. You have countries that are advanced, as you rightly said, in some fields, others that are a bit lagging behind. But a testimony is that this platform provides knowledge sharing, experience sharing, skills sharing. We've seen it actually in COVID. I remember when we had started sequencing to knowing the variants that we have on the continent. Some countries were more developed than others, but they actually received some people, and this was also Africa CDC was involved in, to organize how not only we are able to conduct sequencing for many countries, but also transfer the knowledge. And within a year, I think we have moved from 28 countries with the ability to up to 52. This is quickly. The turnaround time of 1 year is quite fast. Second example I can give you is that Rwanda is going to be soon a vaccine-producing country. And of course, it's not going to be producing for Rwanda only. It's going to produce for the continent. And there are many platforms that we'll have access to, so we can materialize this. So just to say that even that model, don't necessarily need everyone to move at the same pace, but in a coordinated way, build on each other's strength, and the good is common. We all reap benefits out of it. So I think we are in the right direction. We have different mechanisms that are working well. We just need to keep pushing and working hard, and I think we are completely on the right track. Thank you.
Thank you, Honorable Minister. Yes, I see the hand in the room. Let's give 2 hands, actually. 3. Okay, so let me announce that those will be the last 3 hands in the room. So let me give the colleagues online one chance. And I think Dr. Ahmed already started speaking to this. The colleague here from East Africa Bureau, I think the name slipped to come true, but he or she wants to know, there are a lot of conferences that happen across the world, across Africa, and actually sometimes the results are not measurable at every time. 1, the colleague wants to know how different is CPHIA, especially in its physical form this year, and 2, how will the organizers track the progress moving forward? So I think Dr. Ahmed can start, and maybe the co-chair, Prof. Agnes, can add to that.
No, thank you. One, those many conferences were not organized by Africans in Africa. This is different. We're organizing it here ourselves, and we are committing that we are going to implement the outcomes of the discussions. So one very important difference. Second, we are tasking ourselves that based on whichever agreements that have been made, we will develop indicators that will ensure that we can be able to track what is being done at the continental level. And this again, we have tasked ourselves to do. By the end of the meeting, we'll see what the recommendations are going to be. Finally, is let us be measured by the outcome of this meeting and implementation thereof. Let us not be measured by conferences that have been held for decades, and we may not be seeing what the result of the outcomes are. Measure us by the outcome of this meeting and how we'll implement it over the next 1 year.
Thank you. I think Prof is nodding, so she doesn't want to add to that. Let's just continue with the questions in the room. So we've got three. We'll take actually three ladies. Okay, let me start from here. No, let me do her justice.
Thank you. My name's Alice Kajina. I work at the New Times, Rwanda. So I have two questions. Yes, so my first question goes to either the co-chair or Africa CDC. What specific challenges that are hindering public health in Africa that makes in any way Africa lag behind, that you are hoping to, at the end of this conference, to have an actionable pathway? And my second point is to Africa CDC. So what new developments do we have in the Africa Medicines Agency taking shape as we move towards achieving the AU's new public health order? Thank you.
I expected Rwanda to ask that question about Armando.
Okay, I'm going to start, and you will continue. Yeah. So, I think that Africa have understood that we need to go for researchers, for research that matter for us. Not research that somebody in New York, Paris, etc., is interested about Africa. That's the first thing we are going to discuss here. That means own our knowledge, own our capacity. Second, this will impact the way we educate. We have universities here. It's a new paradigm to say we should list what we need and make sure that the students that we educate can, once as professionals, solve it. Same for professionals. So this is taking stock about what we are capable for, what we need, and how to bridge the two.
Yeah, no, thank you. I think that first question very clearly answered. About AMA. AMA is the African Medicines Agency. Congratulations to Rwanda for being voted as the host country for the Africa Medicines Agency, a very important step. Now, in as far as operationalizing the Africa Medicines Agency is concerned, there are steps that need to be taken. And two steps have already happened. One is the identifying of which member state is going to host. And the Rwandan government has already provided the facility. It is there, we can be able to see it. The second step is for the leadership of AMA to be in place. The ministers of the state parties have already taken the decision of initiating the process of recruitment for the leadership of AMA, and this will begin early in the new year. We are looking forward to that going quickly so that we can be able to have the leadership in place. The third thing is the Africa Union Commission, the Department for Health, Humanitarian Affairs and Social Development, where AMA is housed, have put together a technical team that is actually establishing a path for when the leadership comes, they don't have to start from scratch. They will already have a very clear path that has already been established. As Africa CDC, our role in making sure that when AMA begins, it begins on the right footing is the regulatory environment. We are already working with the national regulatory authorities to strengthen the networking that they have, because they are going to be the strong base for AMA as soon as the leadership has been put in place. So 3 things that are happening, and we are very pleased with the progress. I am quite confident that very early next year, AMA as an institution will actually begin taking care of its mandate in a more structured and organized way as soon as the leadership is in place.
Thank you. So,
Can I add something? Remember COVID. Remember the vaccine. Remember when Africa was lining up. A country like Rwanda has paid upfront some vaccine and was not served. Was served after a procurement process done by rich countries. And we say this is really undermining who we are. So it's time for Africa to take its future in the health sector in its hand. And that's what you see today.
so our last 2 colleagues, we're going to restrict you sadly to just 1 question each.
Thank you. My name is Karine Omutoni. I'm a journalist at Rwanda Broadcasting Agency. My question is, I just want to ask my question to CDC co-chair. Non-communicable diseases such as cancer, cardiovascular disease, and diabetes are increasingly becoming the main cause of mortality in sub-Saharan Africa. What has the African countries have to do in order to solve that problem? Thank you so much.
NCD.
Let me say what we have done as Africa CDC and the Africa Union first. Then we go to the countries. And I think the countries are here. They can be able to speak to that. One thing that has been missing in the conversation for NCDs on the continent is prioritization. We have data that is collected but not made available quickly. We get data analyzed 3 years later. And this hampers the way in which we respond. So prioritization is what we have done at Africa CDC and the Africa Union Commission, that NCDs have become a priority. Second is we have developed a continental strategy for non-communicable diseases, mental health, and injuries. And using that strategy, we are supporting our member states in implementing activities at country level. Third is what actually our countries need to do is also to prioritize NCDs and then resource the programs in an appropriate way. And you can only do that if you have good data. And that's why we have begun from the point of, can we collect the right data? Can we be able to analyze so that we know what our burden is? A small example I will give is Senegal. During COVID, Senegal did a platform where they asked all those who had comorbidities, and these are largely NCDs, register on the platform so that we prioritize you to get vaccinated. The numbers were very different from what was known to be the NCDs burden in Senegal. So if you go out and look for the numbers, you find that the burden is much larger than we know, and using that knowledge, we can be able to ensure that we have appropriate resources that are being put into NCDs prevention and, of course, NCDs control as well. This is what we've done at our level, but I'm sure the countries are also doing more specific work that they can be able to share. Thank you.
Right. Thank you. So in terms of NCDs, and you are seeing a shift. So countries are progressing from a burden of infectious disease going to now a double burden. So you have infectious disease and non-communicable disease, projected to be more non-communicable disease. So in terms of control, what we do in Rwanda, we have built primarily a health system. So for everything that we do is based on our health system, starting from the community level, going up to the tertiary level. And with that, bring in also supply, bring in manufacturing. So it's designed in that system. So for anything that comes, it comes within that structure. So if I take an example for cancer, for example, you start by prevention. Prevention, you have many ways to tackle prevention. So you have good diet that we encourage, physical exercise, as you know, the car-free day that we do here is among that. And with that, you do screening. We do screening for breast cancer, for example, and you have platforms like the car-free day where we do screening for breast cancer. We combine it with screening for NCDs, diabetes, hypertension. So we are that part of prevention screening. In terms of diagnosis, we have tried to decentralize testing and screening and diagnosis to the lower level of our community. So for like health centers are able to conduct screening for cervical cancer, for example. And cervical cancer, if I can go back a little bit also for prevention, vaccination is something very big. In Rwanda, more than 98% of eligible girls have the HPV vaccine. And with that, you're preventing a big NCD, per se, if you look at the cervical cancer, which is the end game of HPV. But I'm saying we're doing this as a system because if you build something, it reaps benefit in something else. The structure we have put in place to deliver those vaccines are the ones that have actually helped us to scale vaccines when we received them, COVID vaccine. As soon as we got our vaccines, rollout was quite quick. So when you strengthen a system, which is what we'll be discussing in this conference, you reap benefits in everything. So for NCDs, that's what we're doing as well. In terms of diagnosis, we are having different platforms, CT scan, MRIs in our teaching hospitals, treatment, trying to get medicine. You know, chemo is still very expensive, but trying to organize at the continental level how we can do pool procurement, which will reduce the cost. But later on, also manufacturing of these drugs that you can build on the platform that we are doing, but also a capacity of the human resources. Something that we are doing in Rwanda now, we trained all the cadres, starting from the community health workers, nurses, general practitioner that works in hospitals, specialists, but now we have added another layer of subspecialties where you have sub-branches of these NCD where they are treated. We have started training. Actually, in Rwanda, we launched it this year. We have launched about 13 fellowships that include some that tackle NCD, such as cardiology, gynecology, oncology, and others. So this is what we're doing to cover the end-to-end spectrum. This is what we are trying to do in the country, and we are already seeing benefits that we are getting out of that. Thank you.
Thank you, Honourable Minister. One last question. We have to wrap up.
Thank you very much. My name is Alvin Mngadi. I work for Radio Imanzi, and my question goes to Ahmed. We've seen what COVID-19 has done to us, and quite honestly, we managed to defeat it. But recently, there's been a lot of diseases like Ebola and monkeypox. So my question is, what is African CDC prepared to do to make sure that it doesn't become another pandemic, especially now that many African countries don't have enough funds? Thank you.
Thank you. Let me step back and scare you a bit. Today, there are 109 different public health events on the continent. Today, 109. The vast majority don't make it to the news. And when we say public health events, it means a disease entity has been identified within the community that has the potential to spread. Most of them are arrested because of the good work that our countries are doing, and therefore they do not become big. The public health events of concern on the continent today are about 21. Out of the 109, 21 are public health events of concern across the continent. Out of those, 6 we are actively engaged in. So you'll see the cascading of numbers. The problem is not the circulation of the virus or the parasite or the bacteria. The problem is what we do ourselves in response to that particular outbreak. And this is where I fully agree with the minister that when you strengthen the health system, then it can be able to respond to whatever comes. But as Africa CDC, 2 things that are very key in our preparation. One is building our capacity to respond within the first 48 hours. Not just having professionals, because today, when there is an outbreak, the same health worker who was doing routine work is the one who is repurposed to start doing emergency work. It means that the routine work then suffers if you move that particular health worker to do emergency work. So for us, that's where we start. That and right now we are training a volunteer health corps, a standby force, if you want, of health workers who we can remove from health service without affecting the routine health services. Meaning that if an outbreak occurs in country X, instead of a country X pulling out all their health workers doing routine work, we go to country Y and Z and pick a few of those that we've trained, we bring them to country X to make sure that routine health work is continuing while we are responding to the emergency. So this is one thing that we are doing very critical for, and that's why we are more confident. In less than 70 days, the Ebola outbreak in Uganda, we have started a countdown. In less than 70 days, there's no more new cases, we've started a countdown. We've never done that before. It's because of the lessons that we've learned we are putting in place. Second is ensuring that we have the tools that we need, whether it is diagnostics, whether it is therapeutics, whether it is vaccines, whether it is countermeasures. We must develop the habit of having those ready so that we can be able to respond quickly within those first 48 hours that I've said. So our focus as Africa CDC is building the continent's capacity to be able to bring under control any outbreak within 48 hours, so that after that, we are dealing with small numbers. We are not dealing with wild spread within the community. We are on a good path, and we are quite confident that if we keep this path, we are going to achieve that goal of controlling outbreaks within 48 hours. Thank you.
Thanks to our panelists, thanks to you colleagues, those of you in the room, very tough questions, but the panelists have come through. The colleagues online, we also thanks for making up your time. You know, the offices are run by like different people, so now I'm getting signal from all over the room that they have to go. So we want to say thanks. First, I'll start now from the other side. To our co-chair for CPHIA-2022, Professor Agnes Benegao, thank you for making it here. We hope we can have you in the subsequent briefing. To, of course, my boss, Dr. Ahmed Okwe-Ouman, the Acting Director of Africa CDC, and to the Honorable Minister, thanks for making time to join us and interact with the media. We look forward to seeing you again. Thank you, colleague, and let's do this on the last day. Bye-bye.